Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here's what I bring to you from the world of medicine. Can the position of arm during blood pressure screening overestimate test result? A study led by Johns Hopkins Medicine researchers concludes that commonly used ways of positioning the patient's arm during blood pressure screening can substantially overestimate test results and may lead to a misdiagnosis of hypertension. In a report on the study published in JAMA Internal Medicine, investigators examined the effects of three different arm positions: an arm supported on a desk, arm supported on a lap, and an unsupported arm hanging at the patient's side. Researchers found that lap support overestimated systolic blood pressure by nearly 4 mmHg, and an unsupported arm hanging at the side overestimated systolic blood pressure by nearly 7 mmHg. The findings confirm that arm position makes a huge difference when it comes to an accurate blood pressure measurement, says Tammy Brady, MD, Ph.D, Vice Chair for Clinical Research in the Department of Pediatrics at the Johns Hopkins University School of Medicine, Medical Director of the Pediatric Hypertension Program at Johns Hopkins Children's Center, Deputy Director of the Welch Center for Prevention, Epidemiology and Clinical Research, and senior author of the study. And they underscore the importance of adhering to clinical guidelines calling for firm support on a desk or other surface when measuring blood pressure, the investigators added. The latest clinical practice guidelines from the American Heart Association emphasize several key steps for an accurate measurement, including appropriate cuff size, back support, feet flat on the floor with legs uncrossed, and an appropriate arm position in which the middle of an adjustable BP cuff is positioned at the mid-heart level on an arm supported on a desk or table. Despite these recommendations, the researchers say BP is too often measured with patients seated on an exam table without any or inadequate arm support. In some cases, a clinician holds the arm or the patient holds an arm in their lap. In the new Johns Hopkins study, the researchers recruited 133 adult patients between August 9, 2022 and June 1, 2023. Study participants who ranged from age 18 to 80 were sorted at random into one of 6 possible groups that differed by order of the 3 seated arm positions. Measurements were taken during a single visit between 9 a.m. and 6 p.m. Before BP measurements were taken, all participants first emptied their bladders and then walked for 2 minutes to mimic a typical clinical scenario in which people walk into a clinic or office before screening takes place. They then underwent a 5-minute seated rest period with their backs and feet supported. Each person wearing an upper arm BP cuff selected and sized based on their upper arm size had 3 sets of triplicate measurements taken with a digital blood pressure device 30 seconds apart. Upon completion of each set of 3 measurements, the cuff was removed. Participants walked for 2 minutes and rested for 5 minutes. In the same visit, they then underwent a 4th set of triplicate measurements with their arm supported on a desk, a set used to account for well-known variations in BP readings. Researchers found that BP measurements obtained with arm position frequently used in clinical practice, an arm on the lap or unsupported at the side, were markedly higher than those obtained when the arm was supported on a desk. The standard recommended arm position. Supporting the arm on the lap overestimated systolic BP, the top number of a reading, or the force of blood flow when pumped out of the heart, by 3.9 mmHg, and diastolic blood pressure, the bottom number, or the pressure in the arteries when the heart rests between beats, by 4 mmHg. An unsupported arm at the side overestimated systolic by 6.5 mmHg and diastolic by 4.4 mmHg. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.